Hi everyone, I'm Ohanya Doc. In this video, I'm going to discuss epiglottitis. If you like this video and benefit from it, hit the like button, comment below, share and subscribe. Make sure you subscribe. I want to discuss epiglottitis in children because there is a epiglottitis in adults. So in this topic, I'm going to focus on epiglottitis in children. Epiglottitis is the inflammation of the epiglottis, structures that surround the epiglottis, and also it may extend to the uvula. Epiglottis is a leaf-shaped structure that usually move down when you are trying to swallow. It usually form a lid that covers your airway, protecting your airway or protecting food and liquid from entering your airway. Epiglottitis can be caused by bacterial infections. It can also be caused by swallowing hot liquid. This will cause injury to the epiglottis. Injury to the epiglottis, your epiglottis will respond by having inflammation. Inflammation simply means your epiglottis will swell, become reddish, and also become painful. A swollen epiglottis will increase in size and it may block or obstruct your windpipe or your airway. This is a very serious issue that can lead to obstruction of the airway, and this can lead to death through asphyxia. Epiglottitis is a life-threatening emergency. Actually, epiglottitis is said to have killed the first president of the USA, George Washington. He woke up with a sore throat and in the morning, and he died the same day in the evening. There is a diagram here where I want to illustrate about epiglottitis. This is a diagram of a child between 2 to 7 years, because those are the age. That is the age where children are are affected most. So we have the airway. The airway will start from the nose. We have the nose, and we also have the nose cavity. The nose cavity will move down to the throat, then to the this blue structure is the voice box or the larynx. We also have the mouth. This is the mouth cavity. This structure in red, it's called the uvula. Then we have this other structure in red, it's called the epiglottis. Epiglottis, we have said the main function of the epiglottis is to move down. When you are swallowing food or liquid, the epiglottis move down and act as a lid that will cover the windpipe or the trachea, avoiding or making sure that food or liquid does not enter into your pipe. That is the main function of the epiglottis. So when you have an injury or when you have an infection, a bacterial infection or injury will injure this epiglottis. Your epiglottis will swell. When it swell, it will increase in size. When it increases in size, it will obstruct or block the airway. This means that you will not be able to breathe. If you are unable to breathe, this one can result to death through asphyxia. Why are children between the ages of 2 to 7 years have most severe cases of epiglottitis? This is because the epiglottis of a child, the epiglottis of a child is on the upper side, and it is usually on the front side of the neck compared to an adult epiglottis. Number two, the angle between the epiglottis and the trachea is slanting in children, and it's different in adults. Number three, the epiglottis of a child is floppy. It means that it's hanging loosely, while the epiglottis of an adult is rigid and kind of stiff. So those three anatomical factors will make children have severe cases of epiglottitis than in adults. Why? What are the signs and symptoms of acute epiglottitis? One, your child will have fever. The fevers may be ranging from 38 degrees to 40 degrees. Your child will also have a sore throat. Your child will also have difficulty swallowing. Your child will also present with drooling of saliva because they are unable to swallow, or they have that difficulty in swallowing. They will not want to swallow saliva, so they will be drooling. And number five, your child will have what we call hot potato voice. They will be speaking like someone who has a hot potato in the mouth. And number six, your child will have what we call a tripod position. Tripod position means that your child will stay in a position that he or she will be slightly leaning forward, sitting up on on his arms, and also the tongue will be protruding out. This is to create or try to focus in a position that is comfortable for breathing. And also, your child will have what we call inspiratory stridor. Inspiratory stridor is a loud, harsh, high-pitched musical sound that occur when the child is breathing in. It is produced by turbulence flow of air, or when air is trying to flow through a partially obstructed airway or the windpipe. This one will result to that symptom we are calling inspiratory stridor. You can think of inspiratory stridor as that loud, harsh whistling sound that is produced by the exhaust fumes of those madris or matatu that ply Buruburu or Rongai or Embakasi. And also, your child will also present with labored breathing. Labored breathing consists of high breathing rate. Normally, the breathing rate is from 12 to 18 breaths per minute. So your child might be breathing at a rate of 40 breaths per minute. And also, your child will also have a high heart rate. Your child will also have what we call flaring of the nose. Flaring of the nose is the widening of the nostrils when your child is trying to breathe in. And also, your child will also have what we call chest wall indrawing. Chest wall indrawing means around the neck and also around the ribs, they will appear like those parts or those places are trying to sink in when the child is trying to breathe in, because they have that increased respiratory effort. Epiglottitis can be caused by infectious causes, and also it can be caused by non-infectious causes. Infectious causes, the most common cause of infectious causes is a bacteria we call Haemophilus influenza type B. Haemophilus influenza type B is a major cause of epiglottitis, but fortunately, there is a vaccination that prevent or protect your child against contracting Haemophilus influenza type B. This vaccination is given at 6 weeks, 10 weeks, and 14 weeks. So make sure you take your child for vaccination to avoid contracting these bacteria. Other bacteria that can cause epiglottitis, we have group A streptococcus, we also have staphylococcus. Other viruses that can cause epiglottitis, we have herpes simplex virus, and also for those children whose immunity is low, we have fungal causes like candida or candida albicans. And infectious causes of epiglottitis, we have direct injury or direct trauma to the throat. We also have burns. when a child ingests or swallow a hot liquid or a toxic liquid, this can cause injury to the epiglottis, making the epiglottis swell and also creating what we have described as obstruction of the airway. Then we have causes like those people who usually to try to open their drinks or soda through their mouth. This top of or the cap of the bottle can injure the epiglottis, resulting to epiglottitis. For adults, there are those adults who smoke or take crack cocaine or marijuana. This one may cause direct injury to the epiglottis. How is epiglottitis diagnosed? We have said epiglottitis is an emergency. So one, in emergencies, epiglottitis is diagnosed clinically. Clinically means those signs and symptoms we have mentioned, and also your doc should not try to examine the throat of a child in a very severe acute epiglottitis, because this may block the airway. Treatment of epiglottitis can be through one. We have intubation. Intubation is the insertion of tubes in through the airway or into the trachea that can help in ventilation. We also have a procedure we call tracheostomy. Tracheostomy is the surgical a minor surgical operation that you put a hole into the trachea and a tube allowing breathing. And the last, you can give broad spectrum antibiotics. What are the complications of epiglottitis? One, those bacteria that cause epiglottitis can also cause meningitis. Two, if epiglottitis is mild and it's not treated, it can result to epiglottic abscess. Epiglottic abscess is the bile of the epiglottis. Three, we have that infection can move downward and result to pneumonia, and also it can move down to the lungs and result to what we call pulmonary edema. Pulmonary edema is the accumulation of fluid into the lungs tissue. And we also have pericarditis. Pericarditis is infection and inflammation of the most outer part of the heart. That layer that is the most outer part of the heart. It's called the pericardium. And last, this epiglottitis can result to death through asphyxia. If your airway is blocked, then this means that you cannot get enough oxygen, and without oxygen, you cannot survive. Follow and subscribe Wahinya Doc to watch more videos like this. Thank you.